asthma and allergies and the triggers. How does that all work?
Right, they're very closely related actually. A lot of times allergies are triggers for asthma. So people that have sensitive lungs, all those little chemicals that we talked about that are released by mast cells, they actually trigger an immune response and a little reaction in your airways, and it causes inflammation, swelling, and that can lead into your asthma coming out, and you start wheezing and not being able to breathe. So the trigger is actually something, allergens can be triggers, and in order for us to prevent those asthma attacks, we have to control the allergies.
Let's talk a little bit about treatment.
Well, treatment, first of all, is just getting a really good history to find out exactly what it is that you're allergic to. So if it's environmental versus food or versus something in your house that you may be able to remove. And a lot of times by just prevention and removing those foods and dust and getting rid of the carpeting and putting a filter in the home, we'll take care of the problem. However, for seasonal type allergies, when it's going on outside, really we're limited as far as what we can do other than moving out of the area. So we have to resort to antihistamines, like you mentioned, to block that histamine, and something like Singular that, again, covers one of the other chemicals specifically that's released. And of course, there are steroids. These are not the ones that some people abuse. These are just anti-inflammatory medicines for your nose or eye drops to control your symptoms. In extreme cases, we actually have referrals for to see the allergist to give the allergy shots.
Okay, and then what are allergy shots? You hear horror stories. Is it you do it once a year, or is it something you're going in for every week, or does it depend?
Unfortunately, in the beginning, it's a lot more even common that maybe you have to go daily to receive these shots, and slowly it's weaned off. It's a matter of just desensitizing your body against those little particles so your body doesn't see it as something foreign and keeps having a huge reaction to them. By giving just the small amounts daily, the body starts ignoring it after a while. That process takes a while, though.
I see. And how young can you diagnose this in children?
A lot of times, allergies develop at around 2 years of age. We have seen children developing eczema and asthma earlier, but most of the time we wait till around 2 years of age before really making a diagnosis of seasonal allergies. Of course, food allergies can happen a lot earlier.
Right away, yeah. And then can you treat children that young with all the drugs that are on the market?
We reserve the medication really for people that need it. However, it's been approved, some of the medication, especially like Claritin syrup, has been approved to be used for children around 2 years of age.
Okay, super. Well, thank you so much for sharing this very timely information with me and with our guests. We do need to take a short break, and we'll be back with Dr. Hisako.